Good afternoon, everyone. Thank you so much for joining us today to have a discussion and dialogue around youth and tobacco and vaping. Today, we're going to be talking to you and having some amazing speakers and really talk about the leading trends on youth tobacco use, why kids are having this addiction, resources that will help you in your students who need to quit and want to quit, and then the opportunity for district leaders to receive supportive information to implement for tobacco-free school framework. And so I'm so excited today because we have an amazing speaker here with us today, Dr. Denise Nunez, who was born in New York City and graduated from the University of Miami. She obtained her medical degree from Chicago Medical School, Illinois, and her residency in pediatric neurology track, where she also completed her training and her fellowship in preventive medical and public health at the University of California, Los Angeles. She is the founding member of the Chicago Medical Interdisciplinary free clinics serving rural and low-income families in Illinois. She is an advocate for infants, also children, maternity health, and emphasis on persons with special needs. We're so excited because her goals are to improve the health of all persons, from elderly to infants, with the population health of preventative via thoughtful, innovative, strategic care. And so you're going to hear a lot from her today about the trends and what she's seeing in the school space and young adults. So Denise, thank you so much for joining and sharing all the wealth of information that you have with our AHA family and friends.
Hi, hello everyone. It's so wonderful to spend a little time with you and talk about how we can help our kids avoid some of these issues and how to help you feel confident in assisting them. So it's my pleasure to share this information with you. I hope you find it helpful. So today I'll be talking about health impacts for youth and youth quitting trends. So I'll start with the health impacts. So it's probably pretty obvious to everyone that when you think about how vapes and tobacco use affect physical health, you usually think about the lungs. That's really where the whole process gets started. And so thinking about just what lungs are, they're these fragile bags of air. They're really amazing. They do a great job at filtering things out and allowing you to absorb oxygen so that it circulates through your body. It gives you the energy and all of the vigor that you need to get through the day. But those tissues are really delicate. And although your body is pretty resilient, if there are some strong chemicals in that air multiple times over time, it can cause short and long-term damage. And so this upper little gray bubble is a collection of some of the components that we know are in vapes specifically and in some other tobacco products, but this doesn't include everything. There's a lot that we don't know about what all these products have. They've been around for a while and they've been unregulated and they're not really consistent. So some examples are heavy metals, cancer-causing chemicals, and unfortunately, the flavorings, which are more commonly what our youth use, have some components within them that have already been shown to demonstrate harm. And so we'll be seeing the effects over time on how that rolls out and what that does to our bodies and our lungs. So it doesn't only just affect your lungs when you're exposed to these substances, it really affects your entire body. And so I just wanted to highlight some of the major effects that we can see, some practical things. So unfortunately, if your body is working hard at clearing out some of these chemicals with vapes and tobacco products, it doesn't really have all of its recruits to fight infections. And so your rate of infections and the ability for an infection to harm your body is much easier because you're having all these additional chemicals in your lungs. And unfortunately, that means a lot with the current pandemic, since we're dealing with a pathogen that can affect our lungs. It makes us more susceptible to infections. And these chemicals don't just sit in your lungs, they can be distributed throughout your body and affect your body as well. Unfortunately, these unregulated products, the chemicals and just the components can cause injuries because the ones that have heat or batteries can heat up and cause fires, or they can explode since they're also unregulated. And so that's, pretty practical and unnecessary injury to avoid. And then also the effects of nicotine as they stand through tobacco products or through vapes are pretty well known. And so they affect your body and your nervous system in ways that we understand quite well. And this is even worse when it's in a young person's body because their brains are still developing. And so nicotine does stimulate and work with areas of the brain that have to do with attention, with memory, with just your mood, your general sense of things. And so as a child developing and having these substances available, there are higher rates of addiction, later on in your life. And you're getting more used to these issues while your brain is still under development. And so that's a major issue. And this is another important thing to consider, that one cigarette is already a pretty big problem for a child to be exposed to, but these new products, the vapes and the other products that are considered e-cigarettes tend to not have just one cigarette worth of nicotine. They tend to have an entire pack. And so most of our young that are using these products don't know this. Families and those supporting them don't know how much concentrated nicotine is there. And so all of these problems that we discussed earlier are all aggravated, even more so with the level of nicotine. So it affects your lungs, your body and brain development. It also affects mental health. So at my clinic, a lot of the cases that I'm seeing associated with vape use is that the parents come in and say, you know, my child is really irritable. They're really stressed. They're getting snappy. They're fighting a lot, you know, with me, having, you know, any kinds of issues, even attention issues. And it's not always the first, you know, thing that comes up that they might be using vapes or e-cigarettes or tobacco products. Usually along the lines of ruling things out, we'll discover that this is happening, because not all of our patients are comfortable with saying that they're using these products, but it's unfortunate that this is a manifestation of these symptoms. And so overall, the studies have found that using e-cigarettes, those users have double the odds of a depression diagnosis. Vapings can also worsen symptoms of depression. So if you already have that, it can actually aggravate it, although young people are using this to relieve these symptoms. And then use of vapes is associated with higher levels of ADHD and anxiety. So just using this to relieve aggravates it. And if you don't have any of these symptoms, using the vapes can actually activate these symptoms through multiple pathways. But a lot of kids are stressed about getting caught. They're having anxiety if they don't have a vape available, and you know, they're getting a craving. And so it's a pretty difficult situation when it comes to mental health. So this is just a little graph here for those who love graphics, just to show the breakdown of vape use and how it's being manifested by different races and ethnicities, genders, and sexual and gender status. And so this is data from the California Student Tobacco Survey from 2020. So it's not updated with information from this year, but this is just information to show you the different groups that are affected and what we've been finding with that survey. Another slide that's a little bit concerning to see, but important to keep in mind, is that there's certainly evidence that our youth are leading the use of vapes and e-cigarettes. So on the left side are people under 25 that are using these products, and the red line are e-cigarettes and vapes. And so there's a great increase in our youth really overtaking the blue line, which are the cigarette uses. And if you compare that to the right side, which are those over 25, the blue line again is cigarettes. This is generally what has been available and continue to be used, with a little bit of a decline. And then the red line is the e-cigarettes. So people over 25 are increasing use of these as well. So what has COVID done in terms of effects of using these products? So overall, there's been a slight decrease because a lot of our youth are not socializing, or at the time about this data prior to kids going back to school and socializing, they weren't socializing as much. They weren't in environments where they were exposed. So those experimenters, those that are just using it socially or kind of exploring this as a potential activity, they decreased because there was less access to products. But regular users actually increased due to their isolation, boredom, less social interactions, and then being by themselves and shut in might have helped them to use more of it since they could hide it more easily and just be on their own, and so increased potential addictions. So now I'll talk about quitting trends. What are helping our youth quit, and what have we noticed is helpful and supportive of this? So this is from the California Student Tobacco Survey, the same information from the previous slides. So this is information from 2018 compared to 2020. And so the second bar in the first graph is e-cigarettes and vapes, and the fourth bar is the same information, but from 2020. So this is information about students that are have tried to quit in the last 12 months when they took the survey. And so a lot more are trying to quit when they're on e-cigarettes and vapes than in 2018. And so this is a breakdown of that information. The element that I want you to notice is that the blue bar in the second row and the fourth row, which are e-cigarettes and vapes, the blue bar represents that I already quit. And so in 2018, the blue bar was at 25%. And then in 2020, the blue bar was at 72%. So our kids are quitting. They are interested in quitting for those that are in using these products. So the big take-home message about these tables is that youth are trying to quit. They really are trying to quit. Some of them are being successful, some of them are having issues, but they do acknowledge that this is an issue and there is a desire to quit. So what are the quit patterns that are characteristic to our youth? The great thing is that a lot of them are very successful at quitting cold turkey. That's not the case with our older patients. It can be really difficult, but for our young patients, just giving away, getting rid of their device is very helpful. And then with the pandemic, we've noticed that there's unintentional quitting due to lack of access to the product, which is actually quite helpful to reduce this or to start the process of quitting. So what are the barriers to quitting? Unfortunately, youth and young adults might not view themselves as addictive. They might not realize how addictive this product is. They probably don't know that that one vape contains a whole pack. And depending on how fast they get through it, it might be quite impressive to them. So they don't really realize this. Being at school or on campus or wherever they access the products, some of them are scared also of withdrawal, of feeling cranky and uncomfortable. So letting them know that this is less of a case if they're younger can make them feel more comfortable with giving it a try. And then social status and image, of course, these are young ones who are really exploring their social environments. So what are some reasons that they are vaping that makes it difficult to quit? Most of the youth are using this to manage their mental health issues and cope with stress. And they might believe that everyone around them really has access and is using this product and that it's not a big deal. So it's great to kind of carve at that belief and let them know that's not the case. So what are the reasons that they do quit and they ultimately find success, and what can we use to motivate them? So number one is health, but not health in the typical sense. So they're not responsive to the message of, you're hurting your lungs, you're hurting your body, your future is ruined, look at how horrible the lungs look with, all of this chemicals. They don't like that. They totally reject that message. It's too stressful for them. I suppose what they're interested in is in mental health. So they know mental health is an issue. They're using vapes usually for mental health or to help relieve stress. And so knowing and feeling empowered that they're improving their mental health and that their future will be better for their mental health, that's motivating. Financial, of course, most of our youth aren't really making much money or, really have a job. And so the cost of these products and enhancing how they can use this money to do something more Instagrammable, I would say, would be more helpful and motivating. And then being free from addiction and having a empowered sense of themselves. And so here are some variations between the younger youth and the older youth. So younger feel that seem that if they have improved performance in their school and in their athletics, just in how they carry themselves, it's motivating. It's extrinsic against social environment, what their friends believe, if it's a good thing or a bad thing. And then also feeling that they're too young. So saying, addiction is for old fogies. It's for old people, and it's a messy, nasty thing. Like, you don't really need to mess with this problem, is quite motivating. And then for our older youth, financial costs and also freedom of addiction is helpful in motivating them. So supporting quit attempts, giving these messages in a positive way is incredibly helpful, and providing resources that they tend to be more comfortable with. So the number one thing that our youth are worried about is getting in trouble and not having resources that are anonymous. So ensuring that what they're using is anonymous, they don't have to put in information about who they are, and their parents, won't really get a sense that, they're having this major issue, makes them more comfortable. And of course, if they're free, and they're quite tech savvy, so they enjoy apps. Also, quit lines can be helpful. They tend to like more app-based resources, but providing more resources is always better, depending on the variation between our youth preferences. And then for the younger adults that are a little bit older, so young adults, they would tend to also like technical aspects for quit support, and they might be more willing to access in-person treatment, but more with their doctor and themselves than necessarily a group. So these are some examples of some images that our youth have really found motivating: positive images, smiling faces, diverse people they can relate to, and not all the dark, dreary things that the medical fields can bring. And so this is a little image of a funeral that can be had. Some of our youth can bury their vapes, say goodbye to them, and say goodbye to all the problems that they bring. So just having a positive experience, they tend to be more receptive to, and then to give them resources that make it easy for them to quit. So for example, the digital quit kit gives youth tools that are really simple, like making their own flavored water, chewing flavored gum, having toothpicks and things like that, where they can start to make a plan. That's something accessible for them to plan their quit date, and to have tools that will help to support any kind of cravings. And so we provide these resources, and glad to take any questions later, but hope you found this helpful. Thank you.
Thank you so much for, really opening our eyes to what is out there. Recently at a college football game, and I was a little blown away about how much vaping was happening in the college setting. And, really thinking and seeing your presentation about how so many are quitting. And so that's such encouraging news for us. And, later on in the presentation, we're going to open up for questions. So please put your questions in the chat box. I'll have Denise come back and answer those questions. But in the meanwhile, we have Jeff Willett, Dr. Jeff Willett, who is our Vice President of Integrative Tobacco Strategies. Jeff is our Vice President for the American Heart Association, where he leads our American Heart Association Tobacco Endgame strategies that's designed to eliminate the tremendous health impact that's caused by tobacco and also usage of vaping. Jeff was the leading author of one of our first studies examining the prevalence of Juul amongst youth, and the research that was cited in the FDA in one of the early regulatory actions against Juul Lab Incorporated. Jeff has an extensive background directing and evaluating comprehensive tobacco prevention and control. He's also included in serving in research science with the New York State Development of Health, and as the vice president of the Truth Initiative, which is a DC-based foundation focusing on prevention and also reducing tobacco use. And so we're so lucky to have him on staff helping us lead our way in our mission with vaping. And so Jeff, would love to hear from you about what you also are seeing as well, and then the resources that are available to everyone on the phone today.
You bet. Thanks, Paisley, and thanks to everyone for joining today's webinar. So I'm going to talk to you today about trends in youth vaping, policy efforts to address youth vaping, and how the American Heart Association is working with school districts across the country to address the challenges associated with vaping. And before I talk about vaping, it's important to recognize how much progress we've made in reducing youth cigarette smoking. Dr. Nunez had a wonderful slide that showed the reduction in smoking, that was kind of offset by the increase in vaping among youth and young adults. But if we go back to the 1990s and the peak of the Joe Camel era, 1 in 4 high school students smoked cigarettes. And together we worked very hard, for over 2 decades, and today less than 1 in 20 high school students smoke cigarettes. So first, we need to recognize that that's a tremendous public health achievement, going from 1 in 4 to 1 in 20 youth who are smoking cigarettes. Unfortunately, and as Dr. Nunez illustrated, we've recently seen a tremendous increase in youth tobacco use in the form of e-cigarettes. And today, vaping is the new youth tobacco epidemic. More than 2 million middle school and high school students across the United States are vaping. And compared to a few years ago, students are vaping more regularly. Today, 1 out of every 4 students who vapes does so every day, putting them at greater risk of addiction to nicotine and the long-term use of e-cigarettes and other tobacco products. So the fight against big tobacco is constantly changing. If we go back just a couple years, Juul was the market leader among young people. The preferred e-cigarette product among your students was very likely Juul. Well, a little over a year ago, federal regulation, federal policies went into effect that prevented Juul and companies that sold their e-liquids in the cartridges from selling a wide range of youth appealing flavors. So Juul could no longer sell mango and mint and creme brulee and all of the flavors that it had introduced. But that federal policy exempted disposable cigarettes like Puff Bar and refillable systems. So we have to be vigilant with the new products that the tobacco industry is introducing, and we need to address loopholes that big tobacco successfully exploits to continue selling their products and addict new generations, addict our students. So today we're really concerned about flavored products. We're really concerned about menthol. Taylor, if you could go back 1 slide, I just want to talk a little bit more about Puff Bar. Puff Bar is a disposable e-cigarette that looks almost identical to a Juul, but it's designed for one-time use. And because it's designed for one-time use, they are allowed to sell a wide range of youth-appealing flavored e-liquids. 2 years ago, Juul was the market leader among your students. Today, Puff Bar is the #1, it's the top brand used by young people across the United States. It shows you how rapidly this entire landscape can change. It shows you how the industry is taking advantage of loopholes and regulation and continuing to sell products that we know are appealing to young people. So, at the American Heart Association, we recognize that the industry is developing products and they're targeting young people. The industry has to come up with new customers. E-cigarettes are a way that they are doing that today, and products like Puff Bar illustrate the lengths that the tobacco companies will go. So recently, Puff Bar has announced that it is now using synthetic nicotine. So nicotine that's developed in a lab rather than nicotine derived from a tobacco leaf. And they say that because they're using synthetic nicotine, they should be exempt from local, state, and federal regulation regarding tobacco products. Of course, we completely disagree with that. I'm even unsure if it actually is synthetic nicotine in their products. But Puff Bar is a clear example why we all have to be vigilant. We have to constantly monitor what the tobacco industry is doing, and we have to ensure we have the policy and protections in place, especially for young people who shouldn't be using these products in any circumstances. Next slide, please. So where are we today? Again, e-cigarettes are the most used tobacco products among youth. Over 2 million teens across the United States used e-cigarettes in early 2001. That was really at the peak of the pandemic, when many schools were in lockdown and distance learning was the norm. We're unsure what it looks like today, but we suspect that there could have been an increase since early 2021. Fruit, candy, mint, and menthol are the most used flavored nicotine liquids among teens. And since 2019, the use of disposable e-cigarettes has skyrocketed. Over half of youth who use e-cigarettes are using disposable e-cigarettes. Again, those are exempt from the federal regulation around flavored e-liquids. So at the American Heart Association, we're working at the federal, state, and local level to ensure that all tobacco products, cigarettes, e-cigarettes, and other forms of tobacco aren't addicting the next generation. So the rapid increase in youth vaping was caused by an exploitative industry operating in a largely unregulated environment. Students have been the victims of this industry, and school leaders like you have been forced to deal with the unprecedented impact that student vaping has had in our schools. And we recognize how frustrating this issue is for educators. We also recognize that schools are uniquely positioned to positively impact this issue. Schools are on the front lines of the youth vaping epidemic and are able to both identify and support students who may be addicted to nicotine and who need help quitting. So with this in mind, the American Heart Association believes a model tobacco-free school framework is built around disciplinary practices that provide opportunities for students to understand root causes of their behavior and develop positive coping strategies. We believe that using a supportive disciplinary strategy can help students quit using tobacco, avoid repeat violations, and lead to better student outcomes when compared to exclusionary discipline like suspension, expulsion, and loss of extracurriculars. So the American Heart Association developed a tobacco-free school toolkit that provides best practices for addressing student vaping. So why do we believe a supportive approach is so important? And Dr. Nunez really outlined all of this in her presentation. First and foremost, we want to keep students in the classroom and support academic achievement. We know that exclusionary discipline increases the likelihood of negative educational outcomes. We know that especially as we're coming out of COVID, as we're getting back into the classroom time is precious, and we want to maximize the time that our kids are able to spend in the classroom. Also, we want to avoid the negative impacts that the exclusionary discipline can have. Next slide. And Dr. Nunez did a wonderful job outlining this, but student well-being and mental health are related to student vaping and tobacco use. And exclusionary discipline, not only does it not address the underlying issues that may be related to vaping, it could exacerbate them. And again, looking at this as an opportunity to both identify and support those students who are vaping and who may be struggling with some other stresses or mental health challenges. And then next slide, most students want to quit. Schools, again, are the front lines of the vaping epidemic. You are uniquely positioned to support students who want to quit. So we believe that schools should ensure every student is aware of cessation resources through the school or the community, and that every student who's interested in quitting is supported in identifying or enrolling in a cessation program. Next slide, please. So we believe an exemplary tobacco-free school framework addresses 5 key components. First, the definition of tobacco product should include e-cigarettes and all emerging forms of tobacco. Second, we believe that tobacco use and vaping should be prohibited by all student, staff, and visitors on all school grounds and at all school-related activities. Third, we believe that school district policy should address potential tobacco industry interference that could either come through the form of industry promoted prevention or cessation curricula or industry funding for the school district. We know a couple years ago, students testified before Congress that representatives of Juul came into their school district to administer a prevention curricula, during which the Juul representatives talked about how safe and healthy Juul was. While it's unlikely that will happen, many times we want to ensure that district policy would prevent such a thing from happening again. Discipline. Again, we really suggest that the disciplinary approach for tobacco use and vaping is structured to be supportive and restorative. And then finally, support. All students in the district are aware of cessation opportunities. Next slide. So, in our tobacco-free school toolkit, the American Heart Association has identified a number of programs that we believe have a strong evidence base of success. They're based on strong science. They're based on the science that Dr. Nunez outlined. We have recommendations in the program for prevention curricula, for tobacco and vaping cessation programs, and for other alternative to suspension programs that we believe you can implement, again, to support your students, to provide a disciplinary response, but one that has a strong evidence base to help support the students. In our toolkit, there are profiles of each of those programs. So that with regard to information and resources, our tobacco-free school toolkit and other resources that are on heart.org/anti-vaping are all designed to help you address this issue. You can also email us at our dedicated email account, AHA Tobacco Free Schools at heart.org for support planning and implementing your tobacco-free school framework. So I would just like to conclude by thanking you all for the work that you're doing. Exactly. I forgot to mention our new Tobacco Endgame platform. We've also developed this platform for young people to help support young people in sharing their stories in kind of a peer-to-peer format to learn more about tobacco use and vaping and to help spread the word regarding any actions that they're taking to address the issue, and really just to create an environment for young people through a peer-to-peer program to address this issue. So with that, I'd like to thank you all for your time today, and especially everything that you're doing in very difficult circumstances. So Paisley, I'll turn it back over to you.
Thank you. Every time I hear, the resources available and what as a team we want to accomplish, it's incredibly inspiring. We got a question in the chat that I'd love to ask Dr. Nunez about is why do people think vaping is better than smoking? You hear it all the time. They think they're selecting the better, but tell us a little bit about that.
Yes, so there is a lot of misperception about safety with all of these products. The bottom line is that none of them can be considered safe. Anything that has any of these chemicals will still affect your body, will still affect your lungs and your biology. So it's important to not choose between, I guess, what's less or what's better. Like they're all bad. So that's the bottom line. For the vapes in particular, and for the e-cigarettes, the concept is that the nicotine or the product intended to be delivered is more, it's less mixed with other substances, I would say, so more concentrated. And so it doesn't have all of these additional chemicals that potentially a cigarette itself has. But then the unfortunate part about that is that other chemicals are added to stabilize products, to add flavors and such. So there is that component that some people think, well, it's more pure, so it's better. And then other people will think like, oh, it's a vape, so it's a vapor. So it's just this little gas and it's not as bad as like the really nasty smoke. Because with cigarettes, it smells really bad. It, stains your teeth. It makes the environment kind of smelly. And when you use a vape, it can be very easy to miss. You might not smell anything. And so that can give a perception that, one is better versus the other. And so there's a lot of different components, but my message, as a physician would be they're all bad. It's like fried chicken at home versus fried chicken at, not a brand name or anything, but another fast food place.
I was thinking about cheesecake and brownies. Both are probably the best selection of that.
Right, which a brownie versus cheesecake might be better in some senses, but overall the goal is to keep your health at the best and most optimal place. But that's why a lot of people think that. And unfortunately, e-cigarettes were created by a really well-intended person to be a cessation tool, but that didn't really work out in practice. So that there's also that history.
Perfect. One thing that we've seen on the screen in the chat box is, our middle schoolers need to listen to this and hear this. And so a few things. One, we will give you access to this recording. Also the resources that we've been speaking about in this PowerPoint. So there will be a follow-up email that you will have access to these resources to talk to any middle schoolers, high schools, or whoever you want. Jeff, when you think about that middle school age, anything that you're seeing that has been working better than others? And then Dr. Nunez, I will ask you the same question. I'll give you both the chance to answer.
Yeah, I mean, I think with middle schoolers and with high schoolers and really with everybody, the more we can do to educate students and people in general about these products, about the harm that they can cause, about the fact that they contain nicotine and that's an addictive chemical. The industry has done a wonderful job kind of whitewashing this issue and selling these as safe, appealing, like sexy, cool products. And we need to just reset and create a more accurate understanding. So I think that applies to middle school students as well as, really high school students and everyone still on this issue. While e-cigarettes have been around for a bit, they haven't been around as long as traditional cigarettes. And as Dr. Nunez mentioned, they're kind of constantly changing and there's a little consistency across the different product types. So when you have a situation where a product is constantly changing, it's really hard to study the long-term effects of those products. But we know they're not safe. We know they contain, metals and carcinogens, and just inhaling the aerosol into the lungs causes damage. So we know they're not safe and just need to understand that young people know that.
Yes, I totally agree. I couldn't say it better myself. Certainly getting the information out there and leading with an empowering and positive message seems to be very well received. I think the most interesting finding about all of this and what youth are more receptive to was that for me, because when I was younger, I was really scared. I was easily led by fear, like, oh my gosh, it's going to really harm you. But it doesn't look like our young ones are like us, like we used to be. They're like, I'm not hearing it. That doesn't do it for me.
You're fearless.
I want to vape more now because I'm stressed. So it's that positive affirmative message and empowering message to motivate them.
Love that. We have a Kids Heart Challenge program, which is an elementary school-based program, and we're talking about it in a positive, early way about no tobacco and through some of our characters. And so it's perfect that starting at such an early age, they're getting that positive reinforcement not to, and then continuing to learn through science and continuing to learn about what it does to their body in an age-appropriate way. And so I think you both have really brought that to life. We've got a great question that was in the chat as well, is that normally taking into average, it takes 10 quick attempts for somebody to quit tobacco. Do you have that average for vaping users?
I personally do not have the average attempt for vaping. I don't know if Dr. Willett has that information.
No, I don't know that offhand. Yeah, we know that it can take several quit attempts to quit, quit smoking, quit using tobacco. It just speaks to the powerful addiction that can come with nicotine. So that's a great question. We'll have to get back to you on that.
Yeah, we'll follow back up about
Yeah.
that. And so the last question that we have that came through direct message to me, and I'll let you both answer it before we end our day, is what resources that can help youth quit vaping? So what are, Jeff, what are the two things that you would highly recommend, and the same thing for Dr. Nunez?
You bet. I would download our Tobacco-Free School Toolkit and look at Appendix B. Within there, you will find recommendation for a text-based cessation program, a phone-based, and a face-to-face cessation program. I would say look at those options, see what you think might fit best either for your school or for the young people that you'd like to refer to. But we know that there are strong cessation programs out there. The ones that the Heart Association has kind of reviewed and vetted are outlined in our toolkit.
I would second those resources and just add that the Youth Quit Kit is one that I use a lot in my practice, and it's just a simple like PDF that they can download and review, and has additional just practical tips, as I'd mentioned, like it said, like flavored water is very trendy on Instagram and TikTok and all the other. So it just shows, use these different fruits for the, the flavors that you liked, and drink that water instead and keep yourself hydrated. And so just different things like that that are they're free or very affordable, and very practical for what they have access to, just to have a plan for quitting and a plan to manage cravings while they quit, which it can be quite helpful. It can be less daunting to have those small steps that they can practice and try.
Yeah, one of the questions that just came through is what's the cost of a vaping pack, or, it in general, and thoughts on how students are even getting the funds to pay for this. And are there things that school leaders should know?
Yeah, I know that you can buy a 4-pack of Juul cartridges for $16. I know because I just looked online. So that would be, if you can get them for $4 per cartridge. And depending on what state you're in, that could be comparable to a pack of cigarettes. It could be less than a pack of cigarettes if you live in a state with a very high state cigarette tax. So, the product itself is affordable. Just the Juul device, you can get them on sale for $10 or so. So yeah, I think the cost is also a key challenge because they are relatively inexpensive for the danger that they pose.
Which is interesting because, when you think about now what the cost is for a pack of cigarette, it's astronomical, which will give people pause in their wallet. And so opportunity, of course, for us. Well, we want to thank each and every one of you for joining us. This has been a robust conversation. I have so many nuggets now that we'll be able to share with school district leaders across the country. This video, like I said earlier, will be accessible to you. We'll send a link out. Please share it with any of your fellow coworkers or district leaders or superintendent. We are all here to be a resource to you. You will have plenty of resources that you can tap into from both speakers, but we appreciate your time. We appreciate your energy in supporting this epidemic and helping us support curbing students through vaping. So thank you all very much. Hope you enjoyed it as much as we enjoyed our time with you, and have a fantastic day. Bye, everybody.